Brackert, and as you can see, I am so fortunate to work here in the sarcoma program at UCLA and with experts in sarcoma and GIST. And I think I speak for us all when I say that GIST patients really do mean so much to us. Like, you're just, I shouldn't say this, but you are our favorites. And part of it is just the exciting area of GIST. I mean, you see how it went from being misdiagnosed to diagnosed, and then new drug, drug that works amazing, and then new drugs coming, and it's just always exciting. But the main thing, there's a few things I want to stress, but one is the uniqueness, not only of GIST itself, but of each of your individual cases. And that came out just in the few questions that were answered in the slides. There's a somewhat of a standard, but I've never seen two of the same. And, between the location, the way it's diagnosed, I mean, you each have your own story of being misdiagnosed, your surgeries, some went right, some went wrong, some could have been better, medications. And, my part up here tonight is to kind of speak about keeping you on these medications. We've learned enough now that we have an answer that works really well. And when it stops working, you'll learn more, we're always trying to find the next step. But if you don't, as your own advocate, stay on the medication the way you're supposed to stay on it, and I know I'm going to be like this, but it's really important. It's your life. And so what I want to stress is communication. If you're having problems staying on the drug, you're having side effects that are just not manageable, or you need to communicate. Because if you don't, we think everything's fine. We don't know what your daily life is like. And I learned so much from you all, from you telling me what's going on and what worked and what didn't work, and then I can share that with other people. And that's why, Barbara, thank you so much for what you do. Wasn't it great to meet Barbara today? I need to put a face with her name and her help, and I mean, I will say, every newly diagnosed GIST patient that comes into our clinic, I give them your information. And I also give other resources, but I put you first. And the reason is that you're so caring. I mean, and this whole group is very supportive of each other as well. And that's what you need. You need to help each other with what works for you. But don't get too caught up sometimes in what's happening to someone else, because it won't be the same for you. Exactly. You can kind of trial and error, but everyone is very unique. So let me just ask, how many of you today are diagnosed with GIST, and you're here because you have GIST? Okay. And now you call yourself GISTers? I just learned that. I didn't know that was a hip term, GISTers. How many are here today because you're caregivers or family members? See that? That's great. And then we even have quite a few today that are in the medical field. How many came today just to learn more, so you can help more and interact and understand what's going on? Exactly. That's great. So it's funny because the GIST group, because of the support for online things and resources and your knowledge, it's intimidating for me to come up here. Okay, I'm going to talk about symptom management, and really, you all probably know that more than I do, so I will share some basic things. But I'll just share, I was camping this last weekend. I just got back late last night. I was in Florida. And I was sitting around the campfire, and you're talking, what are you going to do Monday when you go back to work? And I said, I'm going to give a talk. And and they're like, on what? And I tell them on GIST. And, so of course I have to kind of talk about the diagnosis, and I mean, it was like the best campfire story ever. I mean, they were so interested, they never knew these things, and then at the end they were like, wow, are you nervous? Like, how many people do you have to speak in front of, and all these questions. I was like, yeah, I'm nervous. because they're really knowledgeable, you know, and I don't know if I'll be able to give them more information. And they're like, oh, just tell them, just do it like you just did it here, you'll be great. And they're like, no, you're not to insult you guys, but you don't know anything about this like they know. So bear with me if I don't give you a lot of new information, but I'll do my best. Again, I'm going to stress the communication. So not just to communicate with your doctor or your nurse what's going on, but also communicate with your caregiver, your family member. As you see, they really care. They're all here today in support of you, and they're in this with you. And sometimes it's harder for the caregiver to go through these things than it is even for you. They see you get your muscle cramps and you know how painful things are and diarrhea and you know everything that you go through, and sometimes they feel helpless and they want to help but they're not sure how. So a little communication with them is always helpful. Also friends. Sometimes friends don't understand this diagnosis and what's going on with you, and you know communicate with them. And even coworkers. Sometimes you go into work and you know they may not understand why you need to take a break, or you're tired, or you know what else is going on. And if you just talk a little bit, I'm sure they'd understand and help support you. So the main take home is to keep you on these medications for as long as we can, with as minimal side effects as we can. So some of the side effects you've already found, you go on them and you might have a rash or you know diarrhea or nausea, and then they kind of resolve on their own over time. And it's hard, but you know you'll hear us say, write it out, keep taking it, you know, hang tough, whatever, because we know that these side effects do calm down after some time. The other thing though too is if you're feeling terrible, don't assume, well, I'm on this Gleevec and I'm supposed to feel terrible. No, let us know what's going on so we can help you. So a few key things I want to point out that I think are the more important side effects to manage are blood pressure. So, you know, we want to make sure you monitor your blood pressure. And you may have a history of hypertension before you even start the medication. So that's a really simple one to monitor and take medication to keep stable. And, you know, we want to keep you under 140 over 80, you know, 130 over 80 would be nice. And so many of you come in and try to blame me for your high blood pressure. I don't know why, but you know, it's really important to monitor it at home and be honest with yourself. If your blood pressure is going up, it's very simple to take medication to help with that. Also lower your sodium, exercise, you know, things like that. But that's a key one. The other thing is fatigue. And you know the fatigue I'm talking about, right? It's not like, oh, I'll take a nap and I'll feel better, or it happens once in a while, you're just a little tired. It's a fatigue that is, you can't move sometimes. And the key is to just kind of know that this is how you are, this is how it's going to be, and work around it. You know, don't prioritize, ask for help for things. Do what you need to do and take the rest you need when you need it. Make sure you're eating well, you drink well, take care of yourselves. You know, that's kind of, I guess, the best thing you can do is listen to your body and take care of yourselves. But I just want to say, if that fatigue starts getting more and more, and it's even worse than normal, you need to let us know, because there's things, you could be anemic. We would have to take some blood work, make sure you're not anemic, or check your thyroid. These medications can affect your thyroid, and come in and you tell us, you know, I'm just dragging more than usual. Well, we should be checking your thyroid routinely anyway, but that would give us a heads up. Oh, we haven't done that in the last year. Let's check your thyroid. The other thing is, if you've had a gastrectomy and some of your stomach removed, you may be lacking in B12. So we may need to do an anemia workup and possibly B12 injections. So that's one thing. Edema. And I know from a cosmetic point of view, the edema around the eyes are really bothersome. And I honestly barely notice it, but it's like, do you see the dark circles under my eyes today? And we notice it in ourselves more so. But one thing we can do, there's not a lot we can do for the edema around the eyes, but if it's bad enough, we can offer diuretics. We can maybe cool compresses. I read about a steroid cream. Bartos was like, I don't know about that. I'm like, I've never tried it either, but I don't know, And that's the other thing when you talk with each other online, someone may say, oh, this helped with the edema around my eyes. The more worrisome edema is, and it's very, very rare, is if it's around the heart or in the lungs, or that, then we need to do different workups. But if you're feeling more short of breath or kind of symptomatic that way, a little more tiredness, and then also the lower edema, the lower extremity edema. So if you start noticing your legs swelling, it's harder to get your shoes on, you need to let us know, because diuretics are very helpful there. The other thing that kind of goes around is cramps, the muscle cramps and the body aches. So simple things to do for muscle cramps are staying well hydrated, make sure that you replace your electrolytes like the magnesium, phosphorus, calcium with the vitamin D. It's very important. And then, that's another thing we check when we do your blood work, is to make sure that your electrolytes, that you're not losing magnesium and phosphorus, calcium. I think it's really important to take those supplements as well. Especially if you're on diuretics, you may need to work with your electrolyte balance a little bit more. Another thing for muscle cramps that you could try is the quinine or tonic water can sometimes help. I know a lot of patients swear by mustard, right? I don't know this, it's just what I've heard. But I do have a funny story. We have one patient that he heard, online, oh, take mustard when you have muscle cramps. So he was in McDonald's, and he was with his grandkids, and his hands started cramping up. And he's like, I need mustard. And so they started opening these packets of mustard and spreading them on his hands. They gave him a bath in mustard. And then he told me he found out, no, you're supposed to eat it. So, I don't know. But just recently I heard soap in the bed. I don't even know why that works, but people swear by a bar of soap in the bed. It's got to be ivory soap or something like that. So who am I to say? I don't know. Another bothersome side effect is rashes. And the rashes are something we see more in the beginning that do go away and resolve on their own over time. But if you need, you could take some antihistamines like Benadryl, steroid cream. It's very, very rare that we need to do an oral steroid, but sometimes we do. But again, you just need to let us know, and we can try some things. I'll go through a few more. Nausea. Nausea is another one that's worse in the beginning, and then your body just gets used to it and it gets better. But we can give you prescriptions for anti-nausea medicines, and you all know to take your Gleevec with food, with a meal and a big glass of water, right? Everyone swears by that one. And I've heard different techniques as they have to take it before their meal, or with their meal, or after their meal, or divide the dose and take half of it in the beginning of the meal and the other half at the end of the meal. But whatever works for you so that you can take it and not upset your stomach is the key. So sometimes trial and error is a good way to do it. Also, if you tend to take it at night with dinner, make sure that you take it at least 2 hours before you go to bed, because just even people that suffer from a little indigestion and things, you don't want to lie down after taking in your medication. Diarrhea, that's probably one of the most common bothersome side effects I hear about. And your intestine actually has cells in them that have like a pacemaker function that express high levels of KIT. So in theory, luckily I don't need that. In theory, it's possible that the diarrhea is related to the c-KIT inhibition of the Gleevec. So it's very common to have loose stools. And that's actually a very simple thing to manage with Imodium, any of the antidiarrheals that you like to use, watching your diet a little bit. Again, making sure you replace the lost fluids, and replace it not just with water, but with liquids that have electrolytes in them. And maybe try some probiotics, yogurt, things like that can help. So we also, it's really important when you come in to come in to see us regularly. Even if you feel like you're just doing fine, you're tolerating your medications, you know, like Dr. Singh was saying, we need to do routine scans, examine you, and routine blood work. And in that blood work, we're checking things like liver function, kidney function, all your electrolytes, your CBC to make sure you're not anemic. Sometimes it can cause the white count to go down, so you can be neutropenic, which means you're more susceptible to infections, so we check that. And then we can work on, what we want to do is keep you on the right dose, but there's also the options of changing the dose, kind of modifying the dose, taking these little vacations, you know, things like that, because the goal is to keep you on the medication, right? So one other thing I'll talk about, maybe I'll talk about a few more things. Is that okay? I'm all about communication. So another thing that doesn't get expressed real well might be emotions. And, you know, there's several of them that occur. Of course, fear. And I think coming to things like this, having your questions answered by your doctors, nurses, help give you more information. And as you learn more, you can feel more in control, and that fear can really subside. Anger is another emotion. These are all normal feelings that come up. And sometimes the anger can be misdirected at your loved ones. And they're the ones that are there to kind of get it. So and even the caregivers can get angry. I mean, it's a very normal feeling. So again, I think talking about that, expressing it, letting people know, you know, your loved ones know where this anger is kind of coming from. It's just, I think it helps to talk about the feelings. Depression. I do see some people come in depressed, and it's understandable. But it's also, it's kind of part of the healing process to go through all these different feelings and emotions. And it's normal, and that's another reason these support groups are so beneficial, because just knowing there's somebody else, they may not have your exact situation, but they're going through a lot. I mean, a lot of the same things, and there's that bond. And, you know, we are fortunate that we have Sims Man at UCLA and therapists around all the time that we can refer you to. But, you know, it's always good to talk to a therapist if you need medications to stabilize mood, etc. They're there for you. The other thing is financial concerns. I'm mentioning this because Barbara actually had the experience where her insurance was changing, and it's the first time she had to worry about getting her Gleevec covered. And I unfortunately see this with, you know, newly diagnosed people. They can't start their Gleevec because we can't get it approved from insurance, and they can't afford it, or, you know. But I just want to let you know there's all kinds of financial assistance out there through the pharmaceutical companies themselves, through different support groups and organizations, cancer groups, and a lot of times your healthcare provider, nurse, can help direct you on where to go to ask for financial assistance or pharmaceutical assistance. And working, sometimes it's hard to work when all this is going on. And there's, you know, Americans with Disability Act to help protect people with cancer and diagnoses as such, so that they, you know, you can work through these things with your employer. So I'm just about done, but the main things I just keep saying is communication. It always helps to write your questions down before you come into the office so you don't forget. We do a lot of email in our office. You can email if something's going on. I've seen pictures of rashes and all kinds of things, but it's best to come in and discuss it. And the research that you do, just even coming to these things, help with your questions even. So it's all good. Another thing, I kind of scattered, but I wanted to hit these points, is keep your medical records. It's so important to keep a folder with your first scans, your surgery, your pathology reports, follow-up scans, your medication history, when you started, your dose, how long you've been on, information like that, because through the years, you won't remember all of these things, and it's nice to have that in a little folder. And again, if we don't hear from you, we just assume everything's great and you're doing well. So make sure if you have any questions, concerns, you let us know so we can help you. And I know the uncertainty is probably the hardest part of, about the diagnosis, the medication, how long will it work for, what if it doesn't work, what should I be on, all these different things. But again, we can all work together to help with that. And so in closing, we want to keep you on the medication, but also make sure that your quality of life is good. And this is another little funny story. I just found out, have you heard the 5 love languages or something like that? Right? So I did the little test, and my love language is quality time. And I think that's really important, that some of these surgeries, the medications, we want to make sure that you recover and are maintained with quality in your life. And so that's what we're here to help you do and take you with us.
Any questions for Sandra?
All these side effects sound terrible. I've been on Gleevec 2 weeks now. When should I expect to get some of these?
Soon. It sometimes takes a couple weeks for them the side effects to kick in, and then again, they can resolve on their own, and some of them you just have to learn to live with. But whatever comes up, what are you going to do? You're going to communicate to somebody, right? And it can work. You may have none. I mean, I've seen people on Gleevec that really you don't even know they're taking anything. And then I've seen people that, based on blood work and different things, we've had to lower their dose or, whatever. So let's hope you're one of those people that don't get any. But if you do, let them know.
Is it important to take the Gleevec at the same time
Yes.
every day?
Take it at the same time every day. And if you go, say you take it at dinner and you wake up in the morning, I forgot to take my Gleevec last night, just skip that dose and take it the regular time.